The fact that we do have this big divergence between numbers in terms of what has been, I guess, sent out or distributed by Operation Warp Speed versus what has actually made it into dose-wise, has made it into people's arms. Where is the bottleneck specifically?
Well, first of all, thanks for having me on, and Happy New Year. It is concerning, but we should also recognize that massive deployment like this often goes through a phase where we learn the mistakes, learn how to make the operations work. And remember, it's not just shipping the dose to a particular location, it's also managing the dose, getting the right dose and the right people with the right people delivering it. And it's very common in massive deployments to have this sort of period. We call it the hockey stick phenomenon in much of the work I've done before, where things look relatively flat, you get very concerned, and then it takes off, because if you have multiple sites, when one site figures it out, a lot of others are doing it at the same time. That doesn't mean that we should let up on the public scrutiny to make sure that this entire supply chain gets much more functional and operational.
Hockey stick. It's interesting to hear that. Certainly something to look for. Brett, I'm curious what you're seeing on the ground at Baptist Health, both in terms of the ability to administer vaccines to staff and sort of that first tier that will be receiving it, and also, I guess, what you're seeing more broadly in the community on the ground there.
Yeah, good morning, Morgan. Thanks for having me. Happy New Year. Yeah, so at Baptist Health here in Jacksonville, Florida, we have a vaccine distribution team that is on the ground, that is doing the work of prioritizing employee vaccines based on risk of exposure to COVID-19. We're following the Centers of Disease, CDC prevention and state and local guidelines. At the same time, as you just discussed, I mean, this is a logistical heavy lift for all of us. So we're in constant communication with the departments of health to plan future distribution for vaccine, among others in the community. We're following Governor DeSantis's executive order. So other vaccine distribution will include other healthcare workers, not just health system employees, adults over at age 65, and any other people in the community whose conditions put them at a higher risk for COVID-19.
Mr. McClung, what are you seeing in terms of COVID patients right now at your hospitals and in the general area in which you operate?
So cases have continued to increase in Florida and Northeast Florida, and certainly here in Jacksonville, much like cases are increasing over the country. We expect unfortunately, we expect this increase to continue. We're looking at a surge on top of a post-holiday surge. Right now, we're able to maintain staffing and capacity and equipment. Our teams are doing an amazing job. Our physicians and nurses and staff are doing an amazing job continuing to provide care during the pandemic, and now having the opportunity to pivot and begin to provide vaccinations to the community as well.
Shepard Smith here. Thanks for watching CNBC on YouTube.